Okay, we're live.
Hi, my name is Irene Burke, and I've been a member of the Deborah's Place Young Professional Board for 4 years, and I currently serve as the Vice President. Thank you for joining this important conversation on food insecurity and homelessness, particularly in light of the growing needs for food and shelter amid the economic fallout of COVID-19. Access to healthy food is one of the most urgent needs in America, and the effects of COVID-19 have exacerbated this crisis dramatically. Before the pandemic, in 2019, approximately 1 in 10 households experienced food insecurity, according to the Department of Agriculture. As a result of the pandemic, that number has increased to approximately 1 in 4 households, according to researchers at Northwestern University. One of the most vulnerable populations facing food insecurity are people experiencing homelessness. Last year, there were over 500,000 Americans living on the streets and millions more at risk of becoming homeless. The pandemic and its economic fallout has shown us more clearly than ever the inaccessibility of basic resources, food and shelter for millions of Americans. Our panelists today are on the front lines of providing these essential resources to the people in our society who need them the most. I'll introduce our wonderful panelists. Laura Simnata is the Director of Nutrition Services at Open Hand Atlanta. She leads the Nutrition Services Program Development and Delivery. Laura has been in the field of nutrition since 2009, working in human services in Chicago over a decade. In December 2018, she joined the Open Hand Atlanta team, where she leads a team of 5 dietitians. During her time with Open Hand Atlanta, she has presented at many conferences and webinars, become master trained in chronic disease self-management, developed the Telenutrition Initiative and service expansion across Georgia, and co-leads Open Hand's Wellness Committee. She's an advocate through the Food is Medicine Coalition and the Root Cause Coalition. Emily Daniels is the Senior Manager of Programs at the Greater Chicago Food Depository, the food bank that serves Cook County. The Greater Chicago Food Depository partners with over 700 organizations across Cook County to ensure nutritious food is available to our neighbors in need. Emily joined the organization in 2011. Her current role oversees health partnerships and programming for veterans, older adults, people with disabilities, and prepared meals. Emily works closely with hospitals, health systems, and clinics throughout Cook County, looking at social determinants of health and how food insecurity can be addressed among patient populations through resource referrals, prepared meals, or food interventions. Deborah Duncan is the Food and In-Kind Services Associate at Deborah's Place. Deborah joined the organization in 2009 and has worked in several programs before taking on her current role. Deborah shops for staple food items for Dolores's Safe Haven and Teresa's interim housing programs, and coordinates food donations for the Greater Chicago Food Depository, the community, and partner restaurants. She also oversees the in-kind donations that come in, ensuring that every bottle of shampoo, every spatula, every toothbrush is carefully sorted and delivered to the appropriate program. Deborah has a background in substance abuse counseling and is a passionate advocate for the women at Deborah's Place. Thank you all so much for joining us today, and I'm looking forward to our discussion. So I'll kick it off with Laura. Could you discuss how being food insecure impacts health and well-being for a vulnerable population in terms of both physical and mental health?
Sure, and thank you so much for having me. I participated in the chili cook-off before, and so I can just imagine all the wonderful smells filling the Deborah Place gym right now, but I'm so happy to be here. Thank you. So I love this diagram to sort of describe what goes into your health. It's not necessarily our partnerships with our healthcare providers that helps explain our health. It's actually all those other social determinants of health.
Sorry.
That's okay. No problem. I'll keep going. That make up our background and where we live, and they really impact our health and our well-being. And there's a lot of research out there that shows, the zip code that you live in determines our health and our health outcomes and our quality of life. And so when you specifically think about food insecurity, though, if you could show the next slide.
Yes.
There's definitely, a cycle of when you enter food insecure, that can sort of impact chronic disease and your quality of life as well. So when you're food insecure, you might try some coping strategies. You might need to buy cheaper food. You might need to skip meals. All these things sort of impact your well-being and your bandwidth for keeping yourself well, which can lead to chronic disease. And when you have a chronic disease, you need to spend more time with your healthcare professionals. You need to make appointments. You need to maybe stay home because you don't feel good. And so, that can really impact your ability to keep a job, which sort of leads to a decrease in household income, but also can lead to those spending trade-offs. Will I pay my rent, or will I buy food? Will I keep the electricity on, or go buy some food? And so this cycle has so many stressors throughout every cycle, and can lead to more chronic disease and extra stress on the body, which certainly impacts your mental health and well-being overall. So I hope that answered your question.
Thank you. Yeah, it's helpful to kind of understand it holistically. As a follow-on to that, could you describe your experiences working with people who are homeless or housing insecure over the last year, kind of in light of the COVID pandemic, and how your organization seeks to meet their nutritional needs in particular?
Yeah, for sure. So, COVID has impacted our nation, our globe, and food insecurity has just skyrocketed. At Open Hand Atlanta in Georgia, we are partnering. We have a couple different programs going on, but a big one right now is that we're partnering with a hospital system that serves the low-income population in Atlanta. And our organization is providing medically tailored meals to their COVID patients who are being discharged from the hospital to home. And, they may not be at a place where they have food when they get home. And so we're very excited to be able to provide them with 2 deliveries of 14 meals so that they can get some nourishment and some good nutrition right away. Some other things we're working on, we've just had a huge increase in the amount of calls that have come through asking for food. How do I get your meals? And so, we've actually had to hire a nutrition resource coordinator to help us, assess people for SNAP if they need it. And connect them with food pantries or connect them with different programs that can help them with their resources, including farmers markets. And it feels a little weird to be talking about farmers markets right now, but in Georgia, the weather's a little warmer. And so the farmers market season is, from February to November. So we're pretty lucky that we have that service year round. What else? So I also am a registered dietitian, and I lead our team of dietitians, and we've been working really hard at providing nutrition education that meets the needs of people who are dealing with homelessness or unstably housed. And, we definitely try to understand what resources they have accessible to them. Do they have an oven? Do they have a microwave? Do they even have knives and cutting boards to prepare meals at home? And so, this helps us build rapport, and it helps us meet them where they are, and so that we can provide care to them. We can provide cooking classes. We utilize the Cooking Matters curriculum to help them build their cooking skills as well. And there's, been a lot of other things. There's definitely a technology divide out there, and COVID has definitely had this bubbled up because of COVID. People don't have access to internet and wireless, and so they're unable to connect with their providers, or even my team as registered dietitians. And so we've been trying to convert our classes into virtual means, but this is still a missing puzzle that we can't reach everybody. And so that's what we're definitely working on every day, is trying to get people access.
Well, thank you. I mean, it's really helpful to understand how you assess kind of the holistic needs, not just of food, but, maybe like you mentioned, an oven or basic utensils, and not just provide people food, but also connect them with programs like SNAP that can really help them meet their nutritional needs. I'd love to get Emily's perspective on, the local response here in Chicago to food insecurity. So kind of over the past year, what kind of increase has the Greater Chicago Food Depository seen in demand for food and also food donations during COVID? And how do you, go about identifying and addressing the needs for this food?
Yeah, first of all, thank you so much for having me here this evening with you guys. I think Laura set a really fantastic stage on kind of what we're seeing across the board in terms of identifying food insecurity. Here at the local level, so the Greater Chicago Food Depository, we're Chicago's food bank. And so across the country, there are over 200 food banks, all kind of with a different geographic region. Our service area is Cook County, and we work through a network of over 700 partners to get food out into the community. About 450 of those partners are what we would consider our traditional network. Those are soup kitchens, shelters, food pantries that are often based in community organizations, faith organizations, community centers, all throughout the county. The other kind of 250 plus partners are our system level partners. So those are larger institutions like a health system or schools where there's multiple locations. Often those programs are targeting particularly vulnerable populations like youth or older adults or veterans. Prior to March of 2020, poverty and food insecurity were already significant issues here in Cook County. But really never in the history of our organization have we seen such a dramatic increase in the number of people seeking out emergency food assistance as we did, as we have this past year. On average, our partners saw visits to food pantries increase by more than 50% during the pandemic, which is like the equivalent of another just about 300,000 people facing food insecurity and looking for different food access points. The positive side of this is we've seen some really incredible groups step up over the past year to meet that rising need. Throughout the pandemic, the Food Depository has launched 55 new partnerships with community and faith-based organizations. Many of them have hosted pop-up distributions in Black and Brown communities that have been disproportionately impacted by the COVID-19 pandemic. On that food sourcing side, though, remember back in those early days of the pandemic in March when the shelves were empty at the grocery store, we were all looking for the same kind of basic necessities. Those issues were rippling through the food bank as well, just at a much larger scale. Planned deliveries of food were delayed, showing up on the wrong days. That time frame of like March and April were a lot of logistics in trying to make sure that we had enough food coming into our building to get out to our partners that are out in the community at the ground level, like making sure that our neighbors have food.
Thank you so much. I mean, it's just helpful to get a sense of the scale of the increase, and then also, how you distribute food to hundreds and hundreds. I think you said over 700 organizations on the ground in communities to really reach people where they are. And it's just an amazing logistical endeavor. And we're so grateful for your work over the past year. I'm kind of curious, like, more or less, where do we go from here? Like, what are your plans and concerns over, the long term for continuing to address food insecurity in Chicago?
Yeah, I think, one of the things that we know is that while we saw such a dramatic increase in need over this past year, we know that it's gonna take a while to get back to normal. May have seen in the news, the Food Depository just this week announced that over $2.6 million in new grants are being administered to kind of help bolster the emergency food system. So there's 4 new pantries kind of in communities where we've seen a large amount of need, as well as 22 new grantees for existing partners to help bolster their programs, to help them expand service. I think what we are recognizing is that all of those needs that were there pre-pandemic are still there. And we're having to be really strategic and efficient with our resources. So in addition to connecting people to that emergency food system, it's how do we help connect them to SNAP? How do we make sure that our partners know how to help support clients in other services? So to make sure that they have what they need at this time.
Yeah, I think that it sounds like kind of a commonality between the Greater Chicago Food Depository as well as Open Hand, that not only are you kind of providing emergency food assistance, but you're also seeking, longer term solutions to get people connected to the resources even outside of your organization that can help them be more secure in sourcing food going forward. So kind of bringing it super local, Deborah, could you discuss your work at Deborah's Place in terms of the increased need for food and other basic resources? And then also, again, like the donations and outpouring of support that have been made to try to meet those needs this year. Oh, I think you're on mute. Deborah, I think you're on mute.
Okay. Again, now, thank you for having me. So my work at Deborah's Place, I have seen a great increase in need for food from our participants, because, as you know, during the pandemic, the women were, being like at home all the time. So once the women are at home all the time, you eat more. You have, you have need to. There's nothing to do but really eat when you're in the house, right? So one of the things that Deborah Place has done is we have tried to meet that need with having like our own little food pantry in the building, non-perishable foods, where they can come and get whatever their needs are, if to get them to the next month, So we established the food pantry at Rebecca Johnson's, and we have one at the PCA. So the women can, if they don't have the means or the funds, because some of our women come in, they have no income. They have no SNAP, anything like that. So they have to get, their nutrition somehow. So that's where we rely on our donors to come in and donate. And they have been really well at that, giving us the non-perishable foods that we need to feed our women. Also, we have one of the things that we also do for Safe Haven and Teresa's is we go grocery shopping. And I noticed that food don't last as long as it used to. And the groceries are more expensive now than they used to. Since the pandemic, is like a gallon of milk is almost $3. So we have, so I do grocery shopping like maybe once a week for them. But I've noticed that by the next week, they out of everything that I bought the prior week, because we feeding over 90 something women, 15, all to collectively we feeding over, I want to say maybe 15, over 28 to 30 women is what we're feeding. So it takes, I've seen a lot of needs as far as their basic needs are concerned, as far as their hygiene and items and things like that. Like even when a woman come into Deborah's place, they come in, well, actually sometimes with just the clothes on their back, so we actually need to have, the toothbrushes, toothpaste, toilet paper, paper towels, just your basic needs, deodorant, and it would make a woman feel, more motivated to do something for themselves if we set them up for success in the beginning. So, and food plays a major part in that, because when you feed your mind, you feel like you want to do something else. You want to take the next step, maybe go look for a job, maybe, call around, maybe go work on a resume, maybe go back to school. It all depends on not only the food that's feeding your soul, but also the people around you to help feed your need, whatever that need may be. And that Deborah's Place has done that very well. I think I've about said everything I can say about that.
Thank you so much. And I think it's so important to really understand food as foundational to, being able to do anything else in your life, and really having like the stability to, accomplish your other goals. And I'm just so grateful to you for your work to make sure that, almost 100 women have, their basic needs met so that they can go on to accomplish the other things to do.
Right.
I wonder if you could talk a little bit, I think you talked about it with the food pantry, but kind of the partnership that Deborah's Place has with the Greater Chicago Food Depository. And also kind of what are the items that you need the most? Like what are in highest demand, I guess, among the women?
Well, the work that we had, the partnership that we have with Greater Chicago Food Depository, is they really supplement what we don't have, that we don't get from our donors, right? So when, like, I get like produce, Greater Chicago Food Depository give us produce twice a month. So we have fruit, fresh vegetables, and then we also be able to go on the shopping list and be able to purchase things through there. Also, Greater Chicago Food Depository have been one of the major components for our safe haven, because our safe haven is, is more like a shelter almost, but our women don't leave. They able to stay there all day. So we feed them 3 meals a day, so they get breakfast, lunch, and dinner, and they snack throughout the day. So Greater Chicago Food Depository definitely gives us, we get the food truck that comes every Wednesday, which is, I think, the food rescue program, if I'm not mistaken, Miss Emily, right? And they come and they get their food throughout the community, from the Jewels, the Target, they relationships. So we get fresh meat, fresh pastries, everything that you would probably get from your grocery store. So that helps a lot. And our items that we mostly see that we're needing is houseware stuff like dishes, pots, pans, silverware. We can always use blankets. Can't get enough of sheets, pillows. We definitely need pillows. And also we still need the non-perishable foods as well, because we are always going to need something to eat, right? So yeah,
I
those
love
about
that.
what our basic needs are right now.
Thank you for sharing that. And I love the food pantry model that you have within Deborah's Place, so women can go and pick the things that they need. So thank you so much for sharing all of that. So a question for the group, and anybody can kind of jump in and add, but how can individuals best contribute to addressing food insecurity and homelessness now that we're learning a lot more about it from this conversation? What can people do to really take action?
I can get us started. I think there's a couple of things. The first one is you can always volunteer. We are always in need of volunteers at all sorts of levels, from volunteering at the food bank to volunteering with our partners in the community. I think this year has been really hard on a lot of our partners. A lot of our partners have a volunteer base that is older, that's had to be really cautious about their exposure over the past year. I think also sharing what you've learned with your network is super important. Sharing the things that you've learned about Deborah's Place, about food insecurity, about how it's manifesting in Cook County and throughout our community. One of the things we're always talking about is making sure that your neighbor knows how to find emergency food resources if they need it. That was a huge piece, especially at the start of the pandemic. A lot of people are reaching out to food pantries for the first time in their life, and knowing how to find those resources it's hard for some folks. And so knowing how to help your friends and neighbors at that time can be really important.
And I would add to Emily's awesome list is to, if you wanted to donate, reach out to the organization specifically that you're interested in donating and asking them what they need. A lot of times it's not just the random can of cranberries out of your pantry. I'm guilty of that. But it's maybe peanut butter or canned tuna, some really nutritious options that they could serve at their facility. But also, like Deborah mentioned, it might be the personal care items that they most need, the pillows, the sheets, the pots and pans kind of items. So definitely reach out to that organization. It might be on their website too, of what they are truly in need of, because that can go a long way.
Yeah, I think it's so helpful to think about, giving not just money, but, items, giving your time, sharing, information with your network. And I think, and Deborah shared some ways that individuals can get involved earlier. But if there's anything else you want to add, feel free.
No, they can just continue to go. We try to update our wish list as our needs changes. So just continue to go on the website and and see what our needs are at that particular time. So yeah.
Thank you. That's really helpful. Because it's not always what you would guess, right?
Right.
And ask and check. So I'm curious, beyond direct food assistance, what programs that your organizations have implemented have been most impactful in ensuring that people are meeting their nutritional needs?
I can kick us off again. Sure. I think one of the second to kind of the emergency food assistance, it's our benefits outreach team. Food pantries and our network and having the physical food is just one piece of the puzzle. Programs like SNAP are a huge trampoline to help lift people out of poverty. But they don't make it easy. It is a long and confusing application, and it's easy for people to make a mistake on it that would prompt a rejection. We have a team at the food depository that all day, every day is working with clients on how to fill out the application, walking them through the steps and the supporting documents, and can also kind of do some case management with the state to see about, you know, what would prompt a rejection, to kind of help people through that process. In addition, they also will help with Medicaid applications. So making sure that clients have access to healthcare too, which is just as important. I guess another big program for the food depository is our workforce development program. Historically, we've had a food service training program designed to teach kind of basic kitchen and knife skills, food safety, and food preparation. They've had to shift during the pandemic, so now it's largely a remote program, but still working with folks on that job training aspect. They've also added a 4-week kind of customer service front of house program to their workforce development kind of offerings, kind of helping with customer service skills, interviewing, kind of some of those other pieces. So I would say those are kind of the 2 big buckets that are really kind of looking at those root causes of hunger and how to help lift people out of poverty.
Yeah, I agree.
And I know, Laura, you shared some of the programs beyond, you know, direct food assistance. You know, you have a range of, you know, nutritional education and other programs at Open Hand. So a couple more questions. Could you describe how your organization builds community with the people it serves and how these social ties impact either health or housing outcomes?
Yeah, building trust in the community is really important. And then this past year, especially, you know, Open Hand has spent a lot of time evaluating our cultural appropriateness of our offerings, of our meals, and our food baskets that we give out, and you know, just trying to you know, serve the community and anybody in the community who might be reaching out to us, and you know, having our nutrition resources, having staff on your staff that you know, speak different languages, and we're providing our nutrition resources in different languages as well. And I think all these things sort of build rapport with your community and build trust. So that's been a big focus for Open Hand this year, especially.
I think so often, you know, we hear people talk about how food is medicine, but it's also, if it's medicine, it needs to be medicine that people want to take. So I think there's a, you know, Laura kind of talked about it, like that cultural appropriateness of food items and making sure we have that variety. And for an organization like the Food Depository, it's a hard ship to make a big turn quickly on something like that. But it's something that we're working on. I think also, you know, what you see in terms of how we've been kind of adding new food pantry partners all of them are anchors in the community that they're in. They're established, maybe they've not had a food program in the past, but they're trusted community organizations because of the other work that they're doing, and they're adding the food piece in order to make sure that resource is available for their community. So really listening to what the community wants and needs, and looking to those anchor organizations to partner with us in that work.
That all makes a lot of sense. And I think what you both emphasized, like the importance of building trust is probably so key to the work that you do. Especially when, people are in a very vulnerable situation. So the last question, I found that the great need for food and housing over the last year to just be heartbreaking. And the silver lining of it all has been that there have been people like you who have responded with compassion and commitment to helping people who need it the most. So who inspires you and what keeps you going?
Well, I would say Deborah's Place Women inspires me and definitely keeps me going, because at one time in my life, I was there. Didn't know where my next meal was coming from. Didn't know where I was going to lay my head, So to watch the women just grow, and not only grow, but move on and have their own apartments in the community. Deborah's Place meet the women where they are. We just try to set them up for success in every area. I mean, case management, health services, food, just everything that will help a woman get to that next place in her life, So that Deborah Place Women really do inspire me, and that keeps me going on a daily basis. Yes, I don't even consider my job a job. It's not work for me. I enjoy just giving back to someone who is less fortunate than myself, and being able to walk in their shoes, because I've been there. It's easier when you have been somewhere and know the struggles, and and you feel like you have actually helped someone,
And I would say, like, from my lens, women like Deborah and the clients that she serve are what keeps us going. We know, like, across the community that our partners are showing up for their clients every day, working their tail off to make sure that their clients and their community and their neighbors have what they need. And so our goal always is, like, to try to break down as many of the barriers that we can to help you. And the work that you're doing is what really keeps us going and has kept us going this past year.
Thank you.
Yes to all of this. And, just all the organizations that are providing food and assistance. But I also am such a big fan of Michelle Obama. I think having leaders in all of our communities and our nation that are lifting up, that food and food insecurity and community gardens are really cool things, So I follow Michelle Obama really closely. Hopefully not too stalkerish, but she's one of my heroes for sure.
Well, I can't thank you all enough. Our panelists are Laura Simnata, Emily Daniels, and Deborah Duncan. Thank you for sharing your knowledge and experiences from your work to ensure that the most vulnerable in our society can meet their basic needs. We owe you a debt of gratitude for this critical work and the information that you shared with us today. So I encourage everybody listening today to take action to support those in your community who lack food and shelter during this most challenging time. If you're able today, a contribution to Deborah's Place will help us ensure that women experiencing homelessness have access to healthy foods and other essential resources. In addition to supporting the residents of Deborah's Place, you'll receive a chili cook-off cookbook with some original recipes with a donation of $25. And every $25 you donate will earn you an entry to win one of our door prizes, including an Instant Pot and spice set for making your delicious chili. The spice set is from the Spice House. A 1-year subscription to Masterclass, so you could really brush up on your culinary skills, and a baking set, and a gift card to Kuma's Corner. So thank you so much for joining us today. Can't thank our panelists enough for sharing your knowledge and experiences.
Thank you so much.
Thank you. Thank you for having us.